Thank you. Hi, everybody. So just to give you a little bit of context of why we're actually doing this meeting today, from April 2023, the CAN 002 indicator on the PCN incentive changed to ensure that practices are adopting and embedding the request of the FIT tests for patients being referred on a suspected colorectal cancer, and specifically urgent suspected cancer referral for colorectal, that is, specifically to make sure that these patients are referred with a FIT test done within 21 days before the referral is sent. So that's 21 days before and including the day of the referral being sent. The indicators for this threshold within the IIF have also changed. So it's actually more difficult to achieve this. So the lower indicator for this achievement is 65% of requests being sent with a FIT result, and the higher indicator is 80%. So it's quite an ask. So hence why we want to do this relatively soon in the year to make sure that you have the opportunity to make sure your systems are up to speed with all of this. Next slide, please. So really the process within this is to make sure that FIT tests are requested with those with NG12 colorectal cancer symptoms, and to make sure the results are sent with the referral in the first place. There's a couple of exemptions here. One is anorectal mass or anal ulceration, where we would ask you still to do a FIT test because it does still help the hospitals to triage those patients, but that's not needed as far as the indicators are concerned. And there are exemption codes for these patients that you can use, and they're all on our website under the symptomatic FIT section if you need to look for those. So patients with a FIT result less than 10 micrograms per gram of hemoglobin, which is the threshold cutoff for the referral criteria, with a normal full blood count and no ongoing symptoms, can be safety netted in primary care if those symptoms are resolving, or referred on a non-urgent pathway. Thinking about the patients that may have ongoing concerning symptoms but with a FIT less than 10, think about whether they may have other potential cancer types. So for example, like an ovarian cancer in a woman over 50, or possibly a urological cancer, or an upper GI cancer like pancreatic cancer. So other urgent suspected cancer pathways may be used potentially for those patients, or obviously there's advice and guidance as well. Next slide, please. So really, the things that you need to make sure that the FIT changes can be implemented is to make sure that you've got enough FIT kits in practice. These should be able to be ordered easily, and hopefully any issues that were being had in the recent past have now been ironed out. You should be getting plenty of stocks through. It's really, really important that the patients are educated about completing the FIT test in a timely manner and returning it as quickly as possible. There's lots of different things that you can do to remind these patients, and we will come on to those things. So around text messages, again, through AccuRx, and that will be touched on later. Thinking about using the ERS advice and guidance when required, that's for clinicians more, and making sure that the numerical FIT tests are included on the lower GI urgent suspected cancer referral forms. As I say, there's lots and lots of other resources available within the Alliance website on this. Next slide, please. So one of the things you can download and print off for the practice are some FIT posters for the reception staff to remind which of the kits to give out, and signpost patients how to fill them in. And there's other resources such as the exemption codes on there as well.